Understanding the causes of diabetes. Introduction. Diabetes Overview. Hey everyone, welcome back to my Health Awareness channel. Today, we're diving into the understanding of what causes diabetes and how it affects our bodies. So let's get started. Diabetes is a chronic metabolic disorder that affects how your body processes glucose, also known as blood sugar. It's characterized by the body's inability to effectively use glucose for energy. This is often due to problems with insulin, a crucial hormone. Insulin acts like a key, unlocking cells to allow glucose to enter and be used for fuel. When there are issues with insulin production or function, glucose builds up in the bloodstream. The causes of diabetes vary depending on the type, but they all disrupt this essential glucose processing system. Type 1 diabetes, autoimmune disorder. Type 1 diabetes is an autoimmune disease. In this condition, the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. As a result, the pancreas is unable to produce insulin. Without insulin, glucose cannot enter the cells, leading to a dangerous buildup in the bloodstream. The exact trigger for this autoimmune response remains unknown. Researchers believe a combination of factors may be involved. Genetic predisposition is considered a potential factor. This means that certain genes may increase a person's susceptibility to developing type 1 diabetes. Environmental factors, such as viral infections, are also being investigated as potential triggers. These infections might somehow initiate the autoimmune attack on the beta cells. Type 1 diabetes typically develops in childhood or adolescence. However, it's important to note that it can occur at any age. Type 2 diabetes, insulin resistance, and impaired secretion. Type 2 diabetes is the most common form of diabetes. It's characterized by insulin resistance and eventually impaired insulin secretion. Insulin resistance means that the body's cells don't respond properly to insulin. Glucose struggles to enter the cells, even when insulin is present. Initially, the pancreas tries to compensate by producing more insulin. This overproduction can maintain normal blood sugar levels for a while. However, over time, the pancreas may lose its ability to produce enough insulin to keep up with the demand. This leads to elevated blood sugar levels and the development of type 2 diabetes. Type 2 diabetes contributing factors. Several factors contribute to the development of type 2 diabetes. These include genetics, lifestyle, age, and ethnicity. Genetics play a significant role. Having a family history of type 2 diabetes increases your risk of developing the condition. Lifestyle factors are also crucial. Obesity, especially abdominal fat, is a major risk factor for type 2 diabetes. A sedentary lifestyle contributes to insulin resistance. Regular physical activity helps improve insulin sensitivity. A diet high in processed foods can also increase your risk. These foods are often high in sugar, unhealthy fats, and calories. Similarly, a diet high in saturated fats contributes to insulin resistance. Choosing healthier fats is important for overall health. A diet high in added sugars can overwhelm the body's ability to process glucose. This can lead to insulin resistance and type 2 diabetes. Age is another factor. The risk of developing type 2 diabetes increases with age. Ethnicity also plays a role. certain ethnic groups have a higher risk of developing type 2 diabetes. These groups include African Americans, Hispanic Americans, and Native Americans. Asian Americans are also at an increased risk. Gestational diabetes, pregnancy-related. Gestational diabetes develops during pregnancy. It's characterized by high blood sugar levels that are first recognized during pregnancy. Hormonal changes during pregnancy can lead to insulin resistance. The body becomes less responsive to the effects of insulin. The pancreas may not be able to produce enough insulin to overcome this resistance. This results in elevated blood sugar levels. Gestational diabetes usually resolves after childbirth. However, it's important to manage it carefully during pregnancy to protect both the mother and the baby. Women who have had gestational diabetes have an increased risk of developing type 2 diabetes later in life. Therefore, they should be regularly screened for diabetes after pregnancy. Conclusion. The causes of diabetes are complex and multifaceted. Understanding these causes is crucial for prevention, early detection, and effective management. Type 1 diabetes is primarily an autoimmune disease. The immune system attacks the insulin-producing cells in the pancreas. Type 2 diabetes is influenced by a combination of lifestyle factors and genetics. Obesity, inactivity, and diet play significant roles. Understanding the causes of diabetes is crucial for prevention. Making healthy lifestyle choices can significantly reduce your risk of developing type 2 diabetes. Understanding the causes of diabetes is also crucial for early detection. Regular screening can help identify diabetes in its early stages when it's easier to manage. Finally, understanding the causes of diabetes is crucial for effective management. Knowing the underlying factors can help tailor treatment plans to individual needs. Thank you for joining us on our Health Awareness channel. We hope you found valuable insights to enhance your well-being. Check the description below for more info. Remember, taking care of your health is essential, and we're here to provide you with the information and tips to support your journey. If you appreciated the content, please subscribe and turn on notifications to stay updated with our future videos. Your health matters, and together we can foster a community of informed individuals. Share your thoughts in the comments below and let us know what topics you'd like us to cover next. Stay healthy and informed.